Joining us now is Dr. Greg Phelps, and Dr. Phelps is with Aleo Health System, which is the parent company of Hospice of Chattanooga. First of all, Dr. Greg Phelps, good morning.
Good morning. Glad to be with you.
Some of the technology we have seen, medically speaking, over the past few years has just been really, really impressive. The topic we're going to talk about mainly this morning is telehealth, how using a phone or a computer can help you in all aspects of your medical life. But I never would have thought that this included palliative or end-of-life care. Fill us in.
Well, as you probably know, there were fairly stringent restrictions on telehealth. The federal government would only allow it for follow-up visits for extremely rural patients. And Aleo and Hospice of Chattanooga covers 8,000 square miles in 3 states. So we do have some very rural patients, but that was the only place telehealth could be used. Now, with the COVID crisis, they suddenly opened the doorway for us to be able to do telehealth with our patients. Interestingly, the Trump administration allowed telehealth, but then didn't include hospice and palliative care in the initial opening of the door, so we had to wait another week before that got clarified that we could do that. But telehealth specifically requires that you have both audio and video through either a smartphone, computer, or other device such as a tablet. And so that way we can see the patient, we can talk with the patient, and it's not just physicians. We can use our chaplains and our social workers can talk with the patients and actually be much more efficient because they don't have the miles in between to see the patients. So
tell us exactly what telehealth includes.
Telehealth, in its best, can include instruments that can be linked to a computer, to like an electronic stethoscope to listen to a patient, or an electronic otoscope to look in the patient's ears. We aren't quite that far, but we can fulfill the basic requirements, which is to be able to see or hear the patient.
Let me ask you this. A lot of the older folks who may be in need of palliative care or hospice care may not be familiar with or even have a smartphone like this. What about them? Are you able to talk with them just using a regular phone line?
We can. There are a different set of billing codes to do that. But yes, they did give us permission to be able to talk to the phones for exactly the reasons you talked about, the elderly and the people who are not as tech savvy.
Is this more financially efficient using telehealth?
It is, but I would say that nothing really substitutes for the ability to actually look and see and touch the patient. As you probably know, the statistics say that 70% of our communication is nonverbal. So we're not doing it for financial reasons, I promise you. But it is a way for us to be able to continue to care for our patients during this unprecedented emergency.
How do HIPAA laws play into this?
Great question. The HIPAA was very stringent. That was why you couldn't use Zoom or FaceTime patients. Actually, we use a HIPAA-compliant platform called Cinzi that all the information goes through to keep it encrypted. That said, the Trump administration has also loosened the HIPAA requirements to as long as you tell the patient that this may not be a secure connection, you don't have to use that kind of computer intermediary, but we think it's much better to keep our patients' privacy.
Dr. Phelps, we only have a minute or so left. Tell me the big important takeaway message that our viewers need to leave this segment with.
All right. I would say that the thing that they need to know most is that it's possible to get care without having to leave the home. It is possible to get a smartphone or even a regular phone. They used to ban even initial visits, but we can do those now. And this has been a revolution in how we can continue care. The other complementary part is we can also do e-prescribing, because the one part you had to do is hand the patient a prescription, particularly if it was a controlled substance, and now we can do that over computers too. So this is a brave new world I didn't think I was going to live with.
It is amazing what technology has allowed us to do, and the work that you and your team at Hospice of Chattanooga do day in and day out is beyond compare. Thank you so much.
Well, thank you.
If you want to find out more information about how telehealth can help you, why don't you get in touch with the folks at Hospice of Chattanooga? They will be able to fill you in. You can check out their website. It is hospiceofchattanooga.org. Again, hospiceofchattanooga.org.